The Not on Tobacco program was developed via an alliance formed between the American Lung Association, CDC Foundation, and various school districts 19 years ago. It was developed as a gender-specific high school-based smoking cessation program and described as a total health approach to smoking cessation, consisting of 10 group sessions and 4 booster sessions. The target population of this evidence-based program are teens ages 14 through 19 who use tobacco products. Major program goals are to help participants reduce or quit smoking and to encourage healthy lifestyle and behaviors. To date, the non-tobacco program has been deemed a highly successful evidence-based program in the sector. What are the reasons behind this program's success? What factors must be identified, analyzed, and implemented to establish a successful evidence-based program? The current manuscript addresses the previously referenced questions by 1. Identifying determinants of health and social factors of the target population, 2. Analyzing infrastructure, 3. Evaluating and investigating delivery, and 4. Ascertaining the politics and ethics involved. Given their developmental stage, adolescents and young adults are uniquely susceptible to social and environmental influences to use tobacco. Several social factors are key influencers of adolescent behavior and activity, such as socioeconomic status, or SES, their community or society that they belong to, their race or ethnicity, and the advertising they are exposed to. For the first variable, a low SES is a powerful determinant of smoking behavior and predominantly accounts for the disparities in tobacco use within the general population. Low SES also interacts with a complex array of other factors to influence smoking behavior. Adolescents who fall into the low socioeconomic category encounter 2 main obstacles as a result of this variable. The first obstacle being that their background and education may have lacked an exposure to tobacco education, and that they could not fully comprehend the information which was presented to them, and or their family, community, and friends are also of low socioeconomic status. Thus, they are surrounded by individuals who are at an increased risk of smoking as well. Considering this information, it is important that the NOT program is aware of the obstacles that a low SES presents and be tailored to address them for the program to be effective in this population. The NOT program addressed these obstacles by implementing it in schools for individuals between the ages of 14 through 19. The material is tailored for students within a specific age range and developmental level, and since the program was run with administrators, discussion and dialogue occurred to ensure that each individual student could fully comprehend and understand the topics. Moving forward, amongst all social factors, an individual's community has among the most significant influence on their behaviors and actions. Adolescents are one of the populations most influenced by their community, thus the behaviors of their family, coworkers, and friends are a major contributor to their own behavior. To address these social factors, the NOT program was implemented in schools and communities in efforts to reach not only individuals, but also acted to build a micropopulation and network of adolescents whom were participating in tobacco education. Additionally, having acknowledged that the weight that this variable holds on the population, this program was designed with 2 of the session topics specifically dedicated to addressing peer pressure and social support. Moving forward, race and ethnicity are key in influencing tobacco cessation program success. Research from the CDC has found that race and ethnicity influence tobacco use, especially among American Indian and Alaska Natives. In certain races and ethnic groups, tobacco holds various meanings beyond that of just recreation. From religious offerings to celebratory purposes to medicinal uses, these reasons for tobacco use can affect the effectiveness of the NOT program. For this program to be successful for students who have a background such as this, it is important for conflicts to be addressed during the program and the students be given the tools to cope with these situations when they occur. The last social factor which impact the target audience of the Not on Tobacco program stems from the media's influence. The tobacco industry targets young smokers, promoting the use of tobacco through various mediums such as television, internet, and particularly social media. Considering the large amount of time and power that the media has over teens, it is necessary that the messages be monitored. Because of this social factor's impact on teens, it was a clear choice to incorporate this into one of the specific topic sessions in the program. Lastly, in addition to the social factors which affect the NOT program target population, there are also diverse perspectives and community health priorities to acknowledge. Things such as the geographical area, family background, friend association, future plans, healthcare beliefs, and ways in which a student thinks and learns were considered in order to design the most effective program for all students. Ways in which the developers ensured that the program addressed a diverse group of populations are through giving the facilitators freedom to modify the program to the students, having the groups with less than 12 people each, and creating several different topics and resources. Furthermore, for an efficacious program to be implemented, the community health priorities were incorporated. Due to the dangers of smoking, it is a priority of the community that their adolescents are protected from this health disparity. The NOT program was able to promote this desire of the community through educating the vulnerable population, resulting in a decrease or cessation of tobacco use. As with any program, there are a number of key players, public health professionals, stakeholders, and funding which must come together in order for a program to be developed, implemented, and ultimately become successful. The key players involved in the Not on Tobacco program were the American Lung Association and West Virginia University. The American Lung Association played a significant role in this program through conducting research, training the program instructors, contributing funding, providing program expertise, and providing coordination and dissemination for the program itself. The second key player, West Virginia University, has been conducting research on teen smoking since 1995. Being a leading research institution on this topic, they played a significant role in providing input from the study populations, contributing to the program creation, collecting and analyzing program results, and eliciting funding. Together, these two organizations worked to develop the intervention setting, curriculum, study design, supportive materials and resources, and the framework for evaluation of the program findings. In addition to the key players, there were also numerous types of public health professionals and external stakeholders involved with the NOT program. Health administrators, human services, health science, and nutrition are among the numerous types of public health disciplines who work together in order to bring this program into fruition and provide continuous support. Moving forward, another component of the NOT program's infrastructure was external stakeholders. External stakeholders involved with this program include teachers, students, school personnel, parents, nonprofit organizations, and professional organizations. Students were the consumer or customers of this public health initiative, thus they were directly affected by the program's success or failure. Teachers, school personnel, and parents were indirect customers or consumers of this program since they were invested emotionally and socially in the students' results. Nonprofit organizations and professional organizations were also external stakeholders since they provided funding for the program, were interested in the benefit to society, were partially responsible for disseminating the information obtained from the study, and evaluated this program's infrastructure in order to better assess future endeavors. The last component of the NOT program's infrastructure were the community resources and funding components required to turn this conceptual proposition into real-world practice. Advanced preparation for the coordination with schools or community organizations that plan to sponsor the sessions, recruitment of facilitators and participants, training of the facilitators, facilitator instruction guides, surveys, and the program curriculum were among the community resources required for the development and implementation of the program. Finally, among the most important of factors which allowed for the NOT program to be a possibility at all was financial support. The Center for Disease Control Prevention Research Center awarded one of the primary sources of funding to this program in the form of a grant. Supplementary funding was contributed from the Virginia Department of Education, the National Office of the American Lung Association, and the American Lung Association of Florida, who was also awarded grants, which allowed for this program to positively impact the lives of many teens. The NOT program was developed by the American Lung Association and West Virginia University collaboration through use of strong academic research, which became the foundation upon which their research design was created. These key players involved in the creation of this program were well-respected scholarly institutions who readily identified and provided information to the public regarding their intent, methodology, funding, infrastructure, target population, facilitators, and settings. As a result of these components, the NOT program was generally accepted by the public and held an overall positive connotation, with no ethical concerns relating to the development of this public health initiative. While ethical concerns related to the development of this program were insignificant, there were a few apprehensions which could be raised in relationship to the delivery of the program. The first potential ethical concern was in regards to the study population demographics. The NOT program's study population consisted primarily of white students, composing over 90% of the race or ethnicity. Considering tobacco usage is high among the Hispanic, American Indian, and Black heritages, these populations should have made up a larger percentage of the study population. Additionally, this lack of diversity in study population demographics also means that the effectiveness finding may not be transferable to all populations and potentially could be an incorrect reflection of the utility of this program curriculum. Another ethical concern involved in the delivery of this program is the setting in which the program was conducted. The NOT program was primarily conducted in schools, which caused adolescents who were in the community but did not attend school to miss the opportunity for education. Also, adolescents who are not actively attending school also have low socioeconomic status, which puts them at a higher risk for smoking. Considering this information, the limited setting in which the NOT program was conducted could be seen as a flaw. Application of this program in a community setting would prove to address adolescents at a high risk for tobacco use or dependence, and would allow for stronger credibility of the program's effectiveness, and allow all adolescents in a community to have an equal opportunity for this public health initiative.